So referring to peripheral neuropathy, we're always looking at what can we do to help improve function and decrease pain. And so more recently in healthcare, there's been a lot of talk about stem cells. Stem cells are really an intriguing option for treating many, many conditions. Research is limited on stem cells, but yet we have found them to be very effective at helping stimulate the body's own innate ability to repair and to heal. We've used them for decades in healthcare. The problem with most stem cells is that to harvest them, it's a very expensive process. We have to harvest them from umbilical cords, from tissue around the amniotic sac. And so to sterilize and isolate those is a very, very expensive process. So it's been difficult. Insurances do not want to cover this. And so for most of our patients, stem cell therapy has been somewhat cost prohibitive. Stem cells have the ability to trigger healing with normal native intact tissue as opposed to scar tissue. So we've seen stem cells help to heal things from wounds, to help improve function in joints, help repair damaged tendons and ligaments, and also help to improve function in nerves after nerve damage. But once again, the problem has been cost and how to make these available. Well, more recently, we're encountering products that help our body to get many of our stem cells out of our bone marrow back into circulation. This is kind of an intriguing process because instead of paying a high amount of money to get stem cells from somebody else that have to go through an expensive, lengthy, very detailed sterilization process to bring them to market, by using something as simple as a supplement, we're able to get your bone marrow to release your living stem cells into circulation. And stem cells do one thing: they help to direct the healing process throughout the body. So if we can get stem cells into your blood flow in an increased number, tissues that are damaged begin to heal. We see that throughout the body with all different tissue types. But maybe more importantly, in regards to peripheral neuropathy, we see improvement in nerve function. Research is still going on in this, and I can't begin to try to explain to you every aspect about how this works. That is still being researched and figured out. But one thing we do know is when we increase the amount of circulating stem cells in the body, good things happen. Things that we weren't sure could improve start to oftentimes do better. Function returns, tissue grows back. We see them in helping to heal wounds. We see them in helping to repair nerve damage, right? Where nothing else changes in the patient. Simply increasing stem cells has had a positive effect in very many patients. And some of the newer supplements where we're using your own native stem cells that you have living in your bone marrow, when we can get those out into blood flow and circulation, the risk is very, very low because they're your cells. There's no chance of rejection. And those stem cells go throughout the body and help facilitate repair and improvement of function. So we've begun to incorporate these with some of our patients who are looking for another solution, something to maybe help a little bit more. We look at that as an area that may help improve your ability to respond to the therapy you're getting, or maybe even help you to improve where you've hit limits and aren't improving beyond what we can do with normal, traditional Western medicine and healthcare. Stem cells are not a magic wand. They are not meant to cure everything, but they are an integral part of our body's repair mechanism. And the more we can bring all of these different variables into play, the more robust of a body response we see in terms of healing, and the better improvement we have when it comes to improvement, specifically with nerve-related injuries and damage, even the wear and tear that comes with peripheral neuropathy. So if some of this is appealing or interesting to you, I suggest reach out to us. We'd be happy to talk to you a little bit more, to go into some more detail about how these systems work. But what we do want to tell you, and what I would like to communicate, is there's usually something we can do. We don't always just have to sit and live the way that we are. There are ways to improve our condition from a neurological standpoint in many cases. Certainly some cases we cannot reverse. There are conditions and things that we do not have those answers yet for. But for many things we thought you just had to live with, we're finding that that's not necessarily the case. So if it's interesting to you, we'd love to hear from you. Thanks.